Welcome to all my ideas. Today we are discussing about the risk factors of NET tumors, that means neuroendocrine tumors. As you know, most of the malignancies or the cancers or something like that are very vital disorders develop in our body or detected in our body or diagnosed in our body usually in the 5th or 6th decade. That means usually either 50 to 60 years of our life. But instead of something like that age group, the NET tumors are usually diagnosed or detected after the age of 65 or 70. And at the same time, keep in mind our very loving Bollywood actor Irfan Khan were killed by the same NET tumors. But unfortunately, he was only 52 years of age like me. So, age plays great important role in the risk factors, and the risk factors of acute pancreatitis or chronic pancreatitis, everything you know, all these factors may contribute to develop the NET tumors. More than that, or there are near about 5 to 10 fold of risk in genetics or family history of the same. But at the same time, keep in mind, even though you may having any of the risk factors, but it does not directly cause cancer or any tumors, and it may only increases the chance. And having the risk factor, it does not mean that it is necessary and you will get a tumor and vice versa. And the risks are more seen in persons, especially with the NET tumors of GIT. And let us study about the symptoms. And first of all, regarding the common features or the common symptoms. Keep in mind, the symptom of NET are basically dependent on the type of the cell, particularly the type of the endocrine cells. As you know, your pancreas is distributed by variety of cells, the exocrine cells mainly, and the endocrine cells. Near about 85 to 92% of your pancreas is equipped with exocrine cells, and near about 10 to 15% of pancreas is supported by endocrine cells. And these endocrine cells are scattered in our pancreas here and there, and that is why it is named as, it looked like a little islands were scattered in our pancreas here and there. That is why these set of cells are termed as islets of Langerhans. In the detailed study of islets of Langerhans, you know that these islets are filled by specialized cells, and the details of the cells are either these cells are named as alpha cells, then beta cells, then delta cells, and polypeptide or F cells. So the clinical symptoms depends on which type of cell is affected in particular area. That means, unfortunately or fortunately, if tumor affects the alpha cells or the tumors which arise from the particularly by the alpha cells, automatically that will cause uncontrolled production of glucagon. When it affects the tumors arise from the beta cells, it will lead to uncontrolled production of insulin. When it affects the delta cells, it affects the production of somatostatin. And when it affects the B cells or the F cells, various polypeptide secretions were affected and the symptoms depends. So let us see whatever may be the type of cell, we can study the common presentation of a person with a neck tumors, and after that we can study the character of tumors in detail. First of all, usually our patients PC may be unexplained weight loss or great prostration with a fatigability. Next symptom may be usually GIT related stomach pain, crampy stomach pain with uncontrolled diarrhea or constipation or other changes in bowel habits. Then next may be increased thirst, and frequent urination. In such condition, the case may be diagnosed as diabetes. So, very common symptoms like great prostration, weakness, fatigability, cachexia, stomach pain, diarrhea, vomiting, constipation, etc. may be considered by we people as other than neck tumors. And the another set of symptoms means when it affects the pulmonary or lung tissues, dizziness or shakiness may be the symptoms. Dizziness may be the number one symptom with the shakiness, and number two, shortness of breath. Patient feel something like that asthmatic, or the case may be considered as a case of COPD. And other symptom may be when it affects the renal or when it affects the adrenal glands, then the symptom may be as or the sign of high blood pressure. Then over adrenergic effect due to the tumor, there may be flushing of face or skin rashes. Then as the pathology advances, there may be swelling or edema of the leg, say the pedal edema. Then some psychological symptoms like confusion, anxiety, irritability, fear of death, etc. can be seen in patients. But unfortunately, most of these set of patients or most of the symptoms may not give undue importance regarding the origin of, and that is why usually the neck tumors get escaped from our diagnosis, because the symptoms may mimicking with so many other disorders. And next can be studied in next class. Thank you for watching.